Hi, my name is Manouchka, and I'm going to be the nurse for today. As you can see, we're not in the hospital setting, so things will be a little different as we're in the hospital. So obviously, if in the hospital, I'll be washing my hands like I did, just as you did at home, and I'll be providing privacy for my patient by pulling the curtains or close the door, whatever I can do to make the patient comfortable, so I can do my head-to-toe assessment. So before I get started, I'm going to use my sanitizer, and I'm going to, okay. First, I'm going to ask my patient for a date of birth and for a name, a date of birth, and also today's day, date, month, and year.
My name is Manouchka. Date of birth is May 4, 1983. Today's Friday, February 14, 2020.
Good. So obviously, if I was in the hospital, should have an ID band. I'll make sure that I check the ID band for the date, for the name and date of birth to make sure that they do match. But for the home purposes, there's no name band. So first, what I'm going to do is assess her head. She has braids, so it's gonna be a little difficult to assess a full scalp, but I'm going to do my best. Good. So obviously, I'll be assessing for any bumps, any not supposed to be there, any open areas, any sometimes people come with lice in the hospital, so we have so I'll be assessing for that too. Obviously, I'll be wearing gloves. Okay, everything seems to be okay. So I'm going to assess her facial nerves. So I'm gonna touch her, I'm gonna press down a little bit gently, and I'm gonna ask her if she has any pain, any tingling, any numbness going on. Any pain as I'm doing that?
No.
Any tingling?
No.
Any numbness?
No.
Nothing? Okay, good. So this is the gland. So things seem to be working fine. Everything is okay. So I'm gonna press gently on the eyes. Any pain?
No.
Anything? Good. So I'm going to pull down the eyelid. Good. Everything seems to be okay. No drainage. And I'm going to use my little flashlight, and I'm gonna flash. Good. So I'm checking for pupil reaction to the light. So the equal on both sides, which is good. So secondly, I'm going to some nose. So I'm gonna have a lift her nose up, and I'm going my flashlight. There's no drainage, no different septum. Good. So secondly, I'm gonna have her open the mouth. I'm gonna have her open the mouth. I'm gonna stick her tongue out, and my flash in the back of her throat. And obviously, there's no going on. Good. I'm gonna have her lift her tongues. Look at her teeth. Teeth are pretty good. It's always good to ask a patient when's the last time they went to the dentist. If they have a dentist they follow it with, any bleeding the gum when they brush their teeth. All this we'll be asking the patient for all this. Thinking what I'm gonna put. You feel that? Mm-hmm. Good. So I'm going to turn inside of her ears. Good. No build up wax. Good. No drainage. Same thing on this side. Good. Also, I'm going to do the whisper test. It's just a whisper something to make sure the patient actually can hear it. Can you hear that?
Yes. I can hear it.
Okay, good. So obviously she passed the whisper test. Then what I'm going to do is check a carotid artery. So I'm just going to palpate it gently and feel it. Mm-hmm. Good. On the other side too. Good. So I'm going to use my stethoscope, the bell by my stethoscope, and I'm going to check for blood. Good. So next, what I'm going to do is assess the lung sound. So I'm going to do the anterior and the posterior of the lungs. So I'm going to use my stethoscope again, And I'm going to have her breathe in and out as I'm auscultating her lungs. Okay. Good. 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 Things seem to be okay. So I'm gonna go back into the back also. I'll skip to the back. Good. So no adventitious sounds. So the sounds that we will looking for, the good lung size are having air pass through the lungs. Obviously, people that have COPD, CHF, any kind of lung disease, we'll be looking for crackles, for stridor, for wheezes. So all these things we'll be looking for. Obviously, she's pretty young and she's pretty healthy. So I didn't hear anything that she's not a smoker. If I not a smoker, so there's nothing like that. So her lungs are pretty clear. Secondly, what I'm gonna be looking for is checking her heart. So the S1 and SC nodes. So I'll be checking for aortic, the pulmonic, the herbs, also the tricuspid and the mitral valve. So what I'm going to do is use the thing, and I'm going to do S1 first. Breathe normally. Good. Good. So I'll be looking for the sound lump down, lump down, lump down. Good. So then I'll be using the bell part of my stethoscope just to looking for any abnormal sound. Good. 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 So along her heart is pretty good. There's I didn't need any abnormal sounds on the lungs, on the heart. Sorry. Next thing what I'm going to do is assess her abdomen. Then I'm also going to assess the spleen, the liver, and also the her kidneys. So I'm gonna have her lay down. So I'm gonna listen for all 4 quadrants. Obviously, I'll be listening. If I don't hear any sound, I'll be listening a little longer to make sure there's the absence of ours. And then I'll be asking the patient too, what's their normal, like going to the bathroom, what's a normal thing? Some people go to every day, every 2 days, every 3 days. Some people go every 4 days. So, and then I'll be obviously I'll ask the patient all these questions to make sure that so there's nothing wrong going on. So let me listen to her abnormal sounds now. Okay. For this video purposes, I'm not going to lift her shirt look at her skin for privacy reason, obviously. So what I'm going to do, I'm going to press down gently, and I'm going to ask her, feel any pain as I'm doing that. Good. Any pain?
No.
Any pain?
No. No.
So I'm gonna put a little more pressure to it, and I'm gonna ask her, any pain?
No.
Good.
No.
Any pain?
No.
Good.
No.
I'm gonna have her on the side so I can
Turn.
yeah, turn aside. Any pain?
No.
Any pain?
No.
And we'll do the same thing for the other side. Any pain?
No.
Any pain?
No.
Good. So obviously she has a good abdominal sounds. Liver is okay, and when I touch it, she didn't feel any pain, so which is good. What we're going to do is assess. We're going to do. Assess. We're gonna have her turn her neck up and down, side to side, up and down. Go ahead.
Stand up.
No, you can sit down. Can you do the neck side to side, up and down, and circular movement? Good, good. So I'm gonna press it down your shoulder. Any pain?
No.
I'm gonna have her lift her arm up like this. No, fist, palm fist up. Good. Can you go like this in the back? Good. Actually, I'm gonna have her stand up so we can actually see it. Good. Any pain?
No.
No. Can you bend down a little bit so I can see the spine? The spine is pretty good. 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 So first I'm going to have her hang up and don't let me. Good. Let me push down. Go again like this. Good. So can I have her make sure that thing is okay? Good. I'm gonna assess for capillary fill. Good. 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 And obviously, I'll be doing a full vital sign by taking the blood pressure, check for pulse oximeter. I'll be using that to for oxygen. I'll be using thermometer for temperature. All this, I will go for full vital signs for her. But like I said, for as a home purposes, we're not going to be doing that. So what I'm going to do, I'm going to use a test called Womberg test on her. Well, I'm going to have her close her eyes and put her close her eyes and to see. Obviously, she passed. She didn't sway side to side, and I'm going to have her do this as her eyes are closed. So I'm going to have her touch her nose as I close eyes on both sides. Go ahead, both sides. Good. I'm going to, you can relax. I'm going to use a pen and I'm going to have her follow with my, no, just with your eyes. Don't lift your head. And I'm going to use my hand and I'm going to put, no,
2 fingers.
No, don't lift your eye, just
2 fingers. 2, 3, 1, 2.
Good. Good. So what we're going to do is assess for graftinesia test, where I'm gonna have her close her eyes while I close your eyes, and I'm going to put that one number on the palm, and I'm gonna have her guess what the numbers are.
8.
Yeah, that was 8.
9.
Good. So she's obviously passed. The last test we're going to do in that category is the Tosca stereognosis test, which I'm going to have her close her eyes again. I'm going to put 2 things in the palm, and I'm going to have her guess what they are. Close your eyes.
3/4.
Good.
Lipstick.
Good. So good. So she did pass it. She did pass that. That's good. So the next thing we're going to do, I'm gonna have her sit down, and I'm gonna have her something called the heel to chin. So she's going to go like this, heel to chin, on both sides. Okay. I'm gonna have her lay down again. I'm gonna assess the strength. Can you lift that leg up? Don't let me push it down. Good. This one. Let me push it down. Good. Now can you flex your knee? Just one. Put it down. The other one. Put it down. So I'm going to press that like a pedal. Don't let me push down. Same thing. Good. So she got good strength. So I'm gonna have her stand up again. And I'm going to have her work. Go ahead. In a straight line. Go ahead. Yep. Good. Good. You can go back. Then I'm going to have her work on her toes to heel, 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 toes to heel. Good. Really, she got good strength. Okay, now you can have a seat. The last thing we're going to do, is so we did measure for the eyes, the nose. We measured for the strength, lung sounds. We did the nose test. We did the heart. We measured for the heart. We did the strength test. At this point, I'll ask the patient, any medical history, any medication they're taking that we should know about before coming here. Obviously, she doesn't have any medication she's not taking. She's pretty young. She's not on any medication. Like I said, if we were in the hospital, the patient would be almost naked, so we can do a full body assessment, but obviously we're not going to be able to do that. So what I'm going to do, I'm going to push it a little bit up, and I can see her skin is dry and warm and appropriate for ethnicity. It's pretty good. It seems to be okay. Okay. So I guess that's we did the whole full body assessment.
Machine bleu.
Obviously not. That should complete our assessment for today. Thank you, and see you later. Oh my.